our mind. So on the background, that particular background, I am going to say about the health benefits of bitter gourd. My topic is effect of bitter gourd clinical trial in pre-diabetics. It's a blind, randomized, crossover trial in India. Need for the study. Each year, about 7 million people develop diabetes. Diabetes is the fourth leading cause of global death disease. Every 10 seconds, a person dies from diabetes-related causes. Number of people living with diabetes is expected to rise from 366 million in 2011 to 552 million by 2030 if no urgent action is taken. As we have conducted study among diabetics also in the first year of our project, so one of the finding is the monthly medical expenditure for the diabetics, they spend nearly around 1,500 rupees per month. So in that, around 1,000 rupees for medication alone. Then for the doctor visit from 229 to 230, approximately 230 rupees. And then for analysis of blood, approximately around 280 rupees. So totally they are spending. And especially if they belong to the low income category, nearly 50% of their income they are spending for the medical expense. And the same data we collected among the others, same study, we could gather one more information that the classification of the subject according to their BMI, 150 samples. In that we could find the pre-obese category, that is 44.7%, obese category 15.9%, and normal range only 36.7%. Among the obese people, the number one grade is only for 11.3%, 2.6% of them were in obesity class 2 and 2% were in obesity class 3. So, dietary and lifestyle modification are the mainstay interventions to prevent or delay the onset of diabetes. In developing countries, 80% diabetics use traditional medicines. Bitter gourd is a traditional medicine and its medical value has been attributed to its high antioxidant properties due to charantin, polypeptide, phenols, flavonoids, isoflavones and other components. Hypoglycemic effects of bitter gourd extracts have been demonstrated in various animal models of insulin resistance. Hence, the present study is undertaken with the following objectives. Objectives of the study: assess the prevalence of pre-diabetics in the age group of 20 to 60 years, assess the socio-economic, demographic information, dietary and lifestyle pattern of the selected pre-diabetics. Supplement bitter gourd juice to selected pre-diabetic subjects. Evaluate the impact of intervention through anthropometric and biochemical parameters. The research design. You could see first phase, we conducted screening of pre-diabetic. In the second phase of the study, conducted socio-economic and dietary survey. In the third phase, clinical trial with pre-diabetics. And in the fourth phase, evaluation of impact, anthropometric and biochemical parameters. And also in the fifth phase, nutrition and health education for the pre-diabetics. So for this, we submitted our study to our ethical committee of our university as well as the ICMR Ethical Clinical Trial Registry of India, CTRI, and we got the approval from both from ICMR as well as from the Avinashilingam Institutional Human Ethical Committee approval we got. In phase 1, screening of pre-diabetic, so first we selected the subject from government and private industries. We are doing some percentage of our study, some in government sector and also from the private industries. And in that we could select the male and female, totally 948 subjects from the age group of 25 to 60 years. So using the pre-inclusion criteria, that is the Indian Diabetic Research Score, and we conducted this part of the study, and then the waist circumference 80 centimeter for women and 94 centimeter for men, and the BMI 27 kilogram per meter square. So all these we under the pre-inclusion criteria we included. See, you can see that subjects, the totally 948 subjects we could select, we could screen using the ID or a score. So 540 male and 408 female subjects. So 57% of male and 43% of the female. So the high risk vulnerable having 60 and above 60 score, it is 35% of male and 36.3% of female. So pre-diabetic confirmed those who are having 100 to 125 milligram of fasting blood sugar. So 11.9% of the male and 13.7% of the female. So totally we could get only 12.5% among the 948% we have screened. So those who are willing to participate as per the clinical trial, as per the inclusion criteria and exclusion criteria, only 9.5% of the subjects. The inclusion criteria we included age above 25 years, 6 male and female, fasting blood glucose 100 to 125 milligram per DL, HbA1c between 5.7 to 7.4%, non-alcoholics, willing to participate in feeding trials and give written consent for that. Exclusion criteria, presence of complications and disorders, taking medications, high blood pressure above 160, 100 for the systolic and diastolic, and low blood pressure, so pregnancy, planning for pregnancy, breastfeeding. So in the second phase of the study, the socio-economic data collected using a questionnaire method. So socio-economic status, dietary and lifestyle pattern, bitter gourd, awareness about the bitter gourd consumption, the quantity consumed and the preparations, everything we could collect, and the personal and family history of the diabetics. So phase 3, overview of the study design, time frame and type of assessment. Now it is a single blinded crossover study. Now the first thing, A and B. So we got the sample A, we mentioned that as Mary, and then sample B as John. These two are two vegetable powders we got from Taiwan. The same powder they gave it to Tanzania group also. So we got that. They processed and freeze-dried the bitter gourd, a particular variety, and converted into powder form. And after the result of the animal study, they packed in 2.5 grams of pack each, two vegetable powder. So, and they sent the powder as Mary and John to us. So we started with Mary. So hereafter I will call A as Mary, B as John. So we started with Mary, run-in period for 2 weeks, and then the intervention period of 8 weeks, washout period for 4 weeks, and again the crossover 8 weeks period with the other vegetable. Okay, so Mary up to 10 weeks, so then after that washout period, Mary was converted into John. John was converted into Mary. Actually, we are conducting, the study is still going on, it is not completed, so it's not possible for us to give any results or conclusion, it is going on. So whatever the little part, I could give only that one. Now these packets are, we requested the pre-diabetic, after providing the packets in person, we went to the industry and then we demonstrated how to prepare the juice by adding 150 ml of water and then just mix it and drink along with your lunch. So you can see how they are using, you can see the photographs. So one person opening the packet, mixing with 150 ml. These tumblers also provided by AVRDC Taiwan. So they are drinking. We are asked them to drink during the lunchtime. Then they are assembling everyone in the lunchtime in a cafeteria, and then we requested them to drink, like that. So like that it went on. The salient findings of the study. The age group of the selected pre-diabetics. So you could see from the data collected, more percentage of people are only in the 31 years to 40 years, and the same approximately the same percentage from 41 to 50 years. So the prevalence is more among the pre-diabetics in the age group of 30 to 50 years. The area of residence for the pre-diabetic, so 60% of them from the urban area, 21.1% of them from the semi-urban area, 18.9% of them from rural area. The activity they are doing, because we have collected the subjects from the industry, we took the office, those who are working in the office, those who are working in the factory and doing heavy manual labor also. So 48.9% doing sedentary activity, 41.1% doing moderate activity, and 10% were doing heavy activity. With regard to the income level, 41% belongs to middle income group, and 12% belongs to low income group, 9% belongs to economically weaker group, and 28% belongs to high income group. And we collected information on the dietary pattern. So 89% of them maximum were non-vegetarians, 9% of them were vegetarian, and 2% of them were ovo-vegetarian, consuming only egg. The meal pattern, the 2 meals per day were consumed by 22.2%. We asked the reason. They say they are purposefully skipping the breakfast. I don't know how they are surviving. They are just not consuming the breakfast and coming to the office. 3 meals per day by 76.7% of the subjects. 3 meals, about more than 3 meals by only 1.1% of the subjects. And all the subjects, 95.6% except few, they are taking hot beverages, either coffee or tea. And another advantage for them is, in the company itself, in the industry itself, they are providing the hot beverages as mid-morning, evening tea, like that. So minimum 3 they are consuming in the office itself. That is the advantage for the subjects, so they could get more coffee or tea. With regard to the exercise pattern, among the subjects selected, 33.3% only, 1/3 of the subject only doing exercise regularly. So among them, 20% are doing walking, 12.5% are doing yoga, and gardening and other activities are done by 3.3% of the subjects. With regard to the body weight, here comes the results, few things. So those who are completed Mary drink, we could analyze, we could find out the difference in weight. So with regard to the male subjects, the initial weight was 70.8 kilogram, and it got reduced to 69.5 kilogram. In the case of female, it was 67.5 kilogram, and it reduced to 66.4 kilogram. But in the case of drink John, the male is weight initially 67.9 gram, it increased to 69.9 gram, and in the case of female, it is 68.8 kilogram, it was increased to 69.3. So as I mentioned, this is not a complete result. Only one part of the result is this. The final result yet to be analyzed. It is there. We have not completed the experiment, so we have to wait for 1 more month. So to combine Mary and John, Mary with the other group of Mary, and comparison between Mary and John, all that is possible only after completing the experiment. With regard to the fasting blood glucose level, in the case of male, we started with Mary, so 113.1 this milligram per dl initially, it got reduced to 99.6 milligram per dl. Then in the case of John, 101.9 milligram per dl, so it is just 3.2 after the intervention period. Now you can find one increase in the 4th week. That week there was a celebration in Tamil Nadu. So all the people, they expressed themselves that they took Diwali. So they said we took lot of sweets. So all of them were upset because the blood sugar increased. Then it got reduced. So in the case of female, you can see that for the Mary group 106.2 milligram and it got reduced to 99.7, and in the case of John group 105.2 milligram, so the same level was maintained after the intervention period. The glycosylated hemoglobin, the Mary group 5.5 initially, and then finally it is 6.03%, and John group 6.6% initially, it got reduced to 5.7. So the result is not final. Lipid profile, you can see in the case of Mary drink, total cholesterol, the same, almost the same. Triglyceride, it got reduced. HDL is increased, and then LDL, it is reduced too much, and then VLDL also almost the same. In the case of John drink, the triglyceride level not much increase, and triglyceride level it's increased, and total cholesterol level not much reduction, and in the case of LDL it's little bit reduction is found, and in the case of HDL not much difference. Conclusion: prevalence of pre-diabetic is 12.6%. Incidence of pre-diabetic is high and among 30 to 50 years of age. Among the selected pre-diabetics, only 33.3% are doing exercise regularly. Consumption of Mary drink resulted in better reduction of body weight, fast blood glucose and LDL cholesterol than that of John drink. Acknowledgement: the authors gratefully acknowledge the support rendered by the Federal Ministry of Economic Cooperation and Development for the fund we received, AVRDC, the World Vegetable Center, Taiwan, all the project collaborators, subjects of the clinical trial. Thanks to one and all. Thank you.
Thank you very much for the presentation. Now this topic is open for discussion. Any question or comment? Yes, please.
I'd like to make a short comment on this study, which is also true for the Tanzanian study. The statistical analysis of the intermediate results we have to be very cautious about because now we are comparing groups, and at the end with this crossover design we will compare each proband to the performance in the two study periods. So probably the outcome will look quite different when the data set is full and we really can compare the different study periods in the individual probands.
So after combining only we will.
Any other questions? I myself may have one question. Is the endpoint of this clinical trial be the reduction of pre-diabetes or the reduction of pre-diabetes into type 2 diabetes? So how long do you expect the clinical trial will be able to end up with the endpoint you are expecting?
Actually, we are doing this for 8 weeks. I can't understand. The clinical trial for pre-diabetics, 8 weeks we have conducted, and for actually we have conducted just collecting the information from the diabetic. We have not conducted any clinical trial for diabetics.
Blood sugar level of the pre-diabetics, and naturally it will prevent the entry into the diabetic stage.
So the endpoint is the hypoglycemic effect among the pre-diabetic patient and nothing to do with any changes or any reductions in pre-diabetes.
See, actually, we wanted to do with the diabetic people, but they are all under medication. So we have chosen the pre-diabetic one. So pre-diabetic, when you give, they become normal or they can reduce the diabetic, hyperglycemia. It is good.
Can we expect the same to be in diabetics also? Can you simulate that?
We have conducted the study, but in order to come to conclusion, we have taken the therapy. With all the diabetic people only, lot of studies yesterday before that. But in order to prevent the effect of medication and other things, we have chosen this. If this is proven, it is naturally good for the diabetes. Maybe we are planning to continue the study with diabetes.
Next step we are planning.
Is there any basis for choosing 2.5 grams of doses?
After the animal study, they only suggested to take 2.5 gram. And one more thing, practically when we experience this 2.5 gram, some of the limitations they say, once after the intake, when they burp, the beta gourd smell is coming frequently. So I don't think if it is more than 2.5 grams, it is not possible for them to tolerate. Because daily they are, it's too much bitter, it's difficult for them to drink. So I think it's, I didn't express to increase again any suggestions.
We have the last question. Yes, please.
Maybe that I didn't get the point corrected. But there's one pitfall with all these studies in pre-diabetics. If you include these programs into the study trials, they normally are psychological drones that they are doing well with their eating. They want to be friendly to the physician. So there's a psychological bias, because this might have nothing to do with the bitter melon or the bitter gourd, but this is a psychological bias in the difference of the glycosylated hemoglobins in the outcome after 8 weeks and so. That's very difficult, and be careful on that, to interpret this on the sake of bitter melon, because there's a psychological bias.
Why the pregnant women are excluded from this experiment? Means, are you expecting any? Why the pregnant women are excluded from your experiment? Are you expecting any side effects?
Yeah, it may be. It is not a confirmed thing. It may go into create complications. If something is happening, it's not advisable. So we avoided pregnancy, and they are also not interested in taking it. We are getting written consent from them now. They are not willing to give the written consent.
So one more thing, there are some sort of uniformity when we conduct clinical trials. Special conditions are not good, unnecessarily they are increased.
I think in both studies we did not want to have gestational diabetes cases in between, and therefore it was good reason to exclude pregnant women.
Next.
Okay. Thank you very much for the presentation.